I don't know how many of you work really with the older people with the elderly, but I believe that this topic is important for all of us, because we know that actually the healthy aging and the health literacy for older people, it actually, if we want to achieve that, we really have to start working with the younger generations. We sometimes say that those people who are 80 or 75 plus right now, they might be already a bit lost target groups for us, right? They already have their habits, they already have it's very difficult to change their behavior, but still, nevertheless, we should promote health, healthy aging, active aging, and health literacy for older people is part of that. Thank you very much for inviting me to speak here. I'm really happy that Belfast takes this issue of health literacy, not very easy issue of health literacy. We learned from, I work with the healthy cities in the Baltic Sea region, with the healthy cities also in Europe. And I know that for many cities, they cannot really comprehend what this health literacy is. It came a few years ago, and they struggle to really understand what's there for them. What is this topic? Is this something new? But I know that Belfast has been a forerunner in the healthy cities work, and it's forerunner also when it comes to the taking serious the health literacy. Yes, I'm taking this. So today, long explanation. Today I'm here to speak about a project, about the health literacy research and practice project that was completed in November last year. It's been running for 3 years, and it's about the health literacy of the elderly people. It's called Intervention Research on Health Literacy Among the Aging Population, IROLA, towards improving the health literacy of older people in Europe. And I would like to tell you what the IROLA project is. I said it ended, but I think it's still alive. What did we do? Why did we do it? What did we do? And what's there actually for healthy cities? What's there for you? What are the lessons and what are the conclusions? Well, the IROLA project, I said, it was 3-year, big project, 22 partners from all over the Europe, coordinated by the University in Groningen in the Netherlands, and co-financed from the FP7 program. FP7 is the research program, but luckily we also had some practices, some pilots there, so it wasn't really pure research for the sake of research. And the main objective of IROLA project was to introduce in European countries the evidence-based guidelines for policy and practice. So there was the big part of IROLA project was to really collect this evidence and to understand what this really means for the practitioners and for policymakers. And well, IROLA's lessons are quite universal. As I said, when we work with healthy aging, we should start working with younger generations. But generally, the target was on the aging people, but on the taking into account how diverse population there is in Europe, and well, for different countries. I said that there were 22 partners from at least 10 countries. So we can say that to some extent IROLA lessons are quite universal and can be used also here in Northern Ireland and in other countries. Why did we do it? We already heard today 2 times at least about the health literacy survey. Health literacy, well, I'm jumping over actually, I see. Well, why did we do it? Yeah, we know from health literacy survey that there is a problem in European countries with understanding health promotion information or understanding the information that the doctors provide to the patients. But we also know that the health literacy is really dependent on it's really correlated with the socioeconomic status of the people. And it's one of the social determinants of health. So actually we can say that there is really no good health or the public health intervention, health promotion programs, they can really fail if people don't understand this message. Well, you know all this. And yes, health literacy survey that was conducted in 8 countries, but we know that many other countries translate the survey and conduct it on their own right now, for example, Norway or Russian Federation. We learned that actually generally, in average, half of the 50% of the population have problem with understanding the health information. Either they have inadequate health literacy or problematic health literacy. And of course, for the vulnerable groups, including the older people, those levels, they go even on, up to 70%. So it's really, really a big issue. And all this, of course, affects the, it's connected, of course, to the well, let's say, lost resources from the healthcare sector and the burden on the healthcare sector, because the older people come back to the doctor, or as we've heard, they buy the medicine and they don't use it. So of course it's all comes together. And what did we do? Well, we managed within the 3 years to conduct several surveys, to several research, and there were actually 9 work packages. In many of those work packages, the work went parallelly. So there were a lot of work with the e-health, with m-health. There was also a lot of work on trainings of professionals, environmental assessment tools. But I cannot tell you today about all this. But one general issue that might be useful and practical are those. Is the model, the comprehensive model for addressing health literacy needs, and well, that's the model, the IROLA model, the comprehensive model that actually shows that to improve health literacy, to improve the healthy aging, the work must be done on. I mean, it has to. The work. Has to be done on the individual level with a patient or with the older person, together with the professionals, and on very many different aspects. So we have here the community support, and I know that this is pretty strong. Here I've heard from the discussions that you have a lot of community programs, but this is not enough. Of course, the empowerment of older people, focus on communication, on different tools that the professionals or the professionals in the healthcare setting or professionals in the other settings can use, but also it's very important to improve the health literacy capacities of the professionals. Well, today we also spoke a lot, not only about the health professionals, but also of you working with the target groups. And another aspect is this health literacy friendly health organization. So actually, how people can navigate in hospital. Can they really find their department? Do they understand that X-rays, Röntgen, and all those different issues? So this is the comprehensive model. It doesn't look that complicated actually. I think it speaks on its own, but of course, when it comes to practice, I believe that this gets very, very complex, but it's good to understand it and it's good to know about it. And also, IROLA prepared a manual for the assessment of the quality and feasibility of health literacy interventions, and evaluated 20 interventions from different countries. So from the countries participating in the project, there were some interventions from Ireland, there were some interventions from Finland and Netherlands, and all those interventions that were actually evaluated and assessed, they can be found on the IROLA website. So there are 20 health literacy interventions, and they are shortly described there. Yes, and I think one of the most practical issues that can be used immediately are those evidence-based guidelines for policy and practice. And they were developed for the member states, for the politicians on the national level, but they can also be applied to some extent, of course, for the politicians on the local level, and also for health organizations. So here are some guidelines, what kind of actions, why health literacy matters, and what kind of actions can be taken to improve health literacy of older people in different settings. So I have a few copies for you, so I'm happy to leave them, and they also can be found on the IROLA website. There were also, I said that there were several different studies that IROLA conducted, and I have here the 3 studies that I feel are most relevant for you, and the conclusions or the results of the studies are most applicable for the work, for the practical work on the community level. The first study, the health literacy and self-management among adults aged 75 and over, and the influence of socio-demographic background. Well, this study generally confirmed that what we know, that the adults above 75 with low health literacy are generally the vulnerable group. The other study, needs and perception of older adults, it confirmed that for older adults it's important to have autonomy, and it's important to have the supportive social network to develop the assertive behavior. So generally everything that we know as empowerment, or empowerment of patient and empowerment of the older people. And I think we all could predict, but now we have the scientific background for that. That it's important. The communities, the peer groups, they are very important in supporting the health literacy of the older people. And the community groups, they can create this supportive, safe environment for older people when they can share their concerns about the health, but where also they can get the advice about their health. So all this is very important, really, to strengthen the health literacy. So actually the work that you are doing fits perfectly into that. So what are those successful health literacy interventions? What did we learn from IROLA, that actually what kind of aspects should be taken into account when planning the intervention that supports health literacy of the older people? Well, use community-based participatory approach, so involve the target group from the very beginning and treat them as equals. Focus on shared decision making, that's exactly. Facilitate networks for older people, so that the older people really can meet together and can be together, can do things together. Engage professionals, so actually don't forget about this training for the older people. We also heard today in the discussions that in many curricula there is no aspect of the health literacy. We learned also in IROLA that the many health professionals, they've never really taught that this is very important, to ask the patient, did you understand what I said, this approach of Ask Me 3 or other approaches. They were really, didn't think that this belongs to their job to check if the patient received the information and knows what to do with the medicine. And we also worked with the pharmacists, so it was really interesting to hear the example from this local example provided here, because also the pharmacists, they also very often they don't feel that this is part of their job to take care for those issues. They're there just to sell the medicine and not to take care for the other aspects. So actually professionals, health professionals, other professionals, they should really be also sensitive to those issues. Yes, and those health literacy friendly environment, that the people really, where they go to the doctor, when they go to the healthcare center or to the hospital, that they really know where they can find themselves. But it also applies to the cities when it comes to the healthy urban planning, and that also that the people can really realize when they hear from the doctor, well, you should exercise more, that they really have the opportunity to do it. So it's all connected, and I think that health literacy is not really a very new concept. It might be the new framing of many different concepts that come together, the healthy urban planning, the health promotion interventions, and all this that we participatory approach, empowerment of patients. So this is only the thing that maybe rises on a different level. That's why it makes it so complicated and so complex for many people to understand. But I think it's just something that gives us, yeah, maybe it puts many different issues together in a different light, or in brighter light, and really shows how important is this cross-sectoral work on different levels. And yeah, we also have the online resource, and I saw that you have it linked to your page. That's the Health Literacy Center. That was the final product deliverable of the IROLA project. So actually, this is the website. The website address is Health Literacy Center EU, and on this website you can find all the information, all the briefs, all the materials that actually IROLA produced. But you also can contribute to the development of the website. You can also upload your materials. You can share. You can actually, yeah, it's a bit more interactive. So it's kind of portal than only the website. But I would suggest you to also go there to check it, and we of course hope that the IROLA ended in November, and that means that also the funding really ended then. But we hope that we managed to somehow create a sustainable platform, and that it will be updated on the regular basis, and you can also contribute to that. Yeah, but what's there for healthy cities? Of course, a lot of different issues, and I mean, this community work, that's the key issue, and I think that here in Belfast there is a very good understanding why health literacy matters, and how improving health literacy can really improve the life of different groups, and of course how it also can help the health system or the public health system to deal with the challenges of aging population. So we know that the health literacy, strengthening health literacy of older people has positive effect on quality and accessibility, and can reduce the demand for health services. And of course that the cities can only benefit from that. I'm not really much aware how much the city or the region is responsible for healthcare costs here, but in Finland still it will change in few years, but actually it's the municipality that bears the main cost. So in that sense, all this work on really taking out people or preventing people in falling to the healthcare system, that's very, very relevant. So it also depends from city to city or country to country, but generally we know that prevention matters, and prevention costs less. And the role of communities and organizations. Of course, we have here and you can find this graph in one of those briefs, that we should empower not only the patients, not only the older people, but actually all the environment around them. So we have here empower relatives, friends, and communities to support people with health literacy needs. Of course, that's also, again, the issue of framing. Do we have to work on this health literacy that is so problematic, or we work around that? Give people the voice, that they can decide what they need, and what's the best way for them to realize their needs, and change this environment, social, cultural, physical environment. I think that we have a lot of very good examples how to change the physical environment. There is still, of course, a lot of work to be done with this culture, supportive culture, and all those soft issues. And just for the end, the few general words, that better health literacy of older people is associated with empowerment, bigger independence in daily life, lower loneliness. I think that's very important, and that's also, I think, important for all of the people, and also important for all of us, and higher social inclusion. And of course, for healthy cities, that creates this caring and supportive environments that healthy cities stand for, and supports healthy aging. And healthy aging has been a very important topic for healthy aging for years. And I invite you to visit the website of, you don't see the address as well, but IROLA EU and Health Literacy Center EU, those are the addresses where you can find more information. But the Health Literacy Center is linked to the Belfast page, so it should not be forgotten and lost. Well, thank you very much for sharing all those thoughts with you, and yeah, thank you.
Thank you.